Today we have the pleasure of meeting Dr. Feyi Hassan Oyewumi, who is an ophthalmologist and the Vision Center Program Director for Eye Foundation Community Hospital in Africa. She is also joined today by two of our patients, Mrs. Abimbola Ayeni and Mrs. Cecilia Agbebi. These are two of the over 300 individuals that have actually been operated upon for cataract as part of our ongoing collaboration in Nigeria between Eye Foundation Community Hospital and Relief for Human Suffering Foundation. Maybe we should start with you, Dr. Feyi. Why don't you tell us a little bit about your organization and the wonderful work that you all do in Nigeria to help people with eye problems?
Oh, thank you. So Eye Foundation Community Hospital is part of the Eye Foundation Hospital Group, which was founded 29 years ago. The community hospital helps those who are in need of affordable eye care by providing subsidized or oftentimes free services so that they can get access to the care that they need. And our ethos is that everyone should be able to access affordable eye care in Nigeria.
That is wonderful. Thank you for sharing that. So now Mrs. Agbaje and Mrs. Ayeni are only two of the many, many patients that have been impacted by the work that you do in your hospital, and also by the collaboration that we have together since 2021. Can I ask you to tell us about their diagnosis? What were they diagnosed with and what was their course of treatment?
Okay, so both patients were diagnosed with cataracts, and this is impacting their vision. So they were not able to see properly to do their normal daily activities. And the only solution that we have for cataracts is cataract surgery. Now, cataracts are the natural lens in the eye that we normally use to see that becomes cloudy. And this usually happens as a result of age. So the older that we are, the more likely we are to develop cataracts. And the only solution for getting help with regards to cataracts is to have surgery so that they can see again.
That's wonderful. So how was your experience operating on these and other patients?
It's always rewarding operating on patients who may not be able to afford care otherwise. So it's a very rewarding experience. Oftentimes, especially the patients that we see, and in these two cases, these cataracts have been there for quite a long time, really impacting their vision. So they have because it makes such a difference to them.
That is wonderful. And I can definitely see the joy in your face as you talk about your experience operating on patients with cataract. And I think it definitely does make a difference for somebody that couldn't see to be able to get their sight back. So thank you for sharing that. Now, if we can turn maybe a little bit to the patient, and I'd like to start with you first, Mrs. Agbaje. I know you shared with us that you're married, you have children, and that you're also the breadwinner. You're the one that really takes care of the family. You started having cataract in your eyes about 4 years ago, but you really were not diagnosed until much, much later, right? Until recently when you came across the Eye Foundation Hospital. So now, can you tell us why did it take so long? Since 4 years ago that you've had this problem, why are you now just getting help?
The reason is that because of money. I can simply say because of money. Because before God gave me these children, it doesn't give me for them to come and suffer. So it means that I have to suffer for them so that they can become something in the future. So because of the money, paying for school fees, taking care of how to feed, I find it difficult to pay money to go and do the surgery. But immediately that I hear about this Relief for Human Suffering Foundation, and I went there, my life has changed and the life of my family has changed. I thank you very much. I'm very, very happy.
And I can definitely feel your energy and passion about this, which makes my heart just, very happy. So thank you for sharing that, Mrs. Ayeni now. So how long have you had the cataract and how has it really affected you and your family?
It takes me a lot of years to do the surgery, but when I hear about this, so I'm so happy that day they called, so they announced the eyes clinic of something. So when they announced it, I just let me attend it. Since all these days, maybe God will take control. And I thank God and I'm giving glory to God today that God used them for me and my family, because my children have been losing thinking that say this woman is going to blind or what, who will be taking you up and down, who will be taking care of you. But I thank God for, I give glory to God that. So I greet all the people that God used for Women's Hospital Foundation to do this surgery for me and my family.
Thank you. I can definitely see how happy you are about this. And that's one of the reasons why we're having a fundraiser to really generate more awareness about this to people as well.